Oh,
Be quiet, Dr. Workman. We're not ready for you to start talking yet. 151 The Buzz. All right, Mitch, it's Ed, and Dr. Michael Workman is
Michael
here.
Workman's here. He comes, Wednesday here and there, and he is a friend of ours, and he also happens to be one of the most renowned and respected plastic surgeons in the area.
He's the best.
He is one of the very, very, very top breast guys in the Pacific Northwest area. And I read this thing and I printed it out because I wanted to get your take on it and see what your experience has been. So they're saying, according to this one article, that plastic surgery, whether it's the face of the body, it comes in waves of what people want done. Yep. Like there's always going to be people that want to have like a rhinoplasty or breast augmentation, but because of celebrities or whatever the trends are, that some things are more popular at some times than others.
absolutely.
And what this guy is saying is right now, there's sort of a moving away from the really large breasts. And people, whereas in years past wanted like a D cup or larger, now they're having smaller breasts implanted, sort of more, I want to say reasonable, but there's more C's than there are D's, and that people more and more are inquiring about or having surgery to try to improve or enlarge in their butt.
And that's a tricky procedure, isn't it?
Yeah, there's a number of procedures for enlarging the butt. I mean, getting back to the breast, I had a patient within the last hour I saw who wanted to have breast augmentation, and she didn't want to look too big in a sweater. And so, I want to go from an A to a B, but she said, and I don't want to look too big in a sweater. And I think what I'm seeing, and I think what we're seeing nationwide, is in terms of women's bodies, we're not quite as voluptuous as we used to be.
Speak for yourself.
That's right.
Well, no,
We are
I
in
mean,
this
just
room.
in terms of, but I think that we're more into, women being thin and the six packs, and I think smaller
More
breasts.
athletic.
More athletic, exactly.
Isn't that interesting?
It really is
Now,
interesting. We're going the other way.
Do you like research stuff like that, or do you just see it happening with your own type of patients that come in?
I listen to my patients and ask, they'll tell me what they want. So
And you see
so
like a
often
pattern sometimes.
You see a pattern, and that's exactly what I'm seeing. And
Interesting.
I'm just thinking of Dallas, like if he were, say, some sort of receptionist or assistant at a plastic surgery place, and a woman came in and said, I don't want to look too big in a sweater, I feel like he would physically hear like the teacher voice in Peanuts cartoon.
Right.
Like she would be like, hi,
relates.
I'm thinking of breast augmentation, and I
Right.
that sweater. Have people been inquiring? I know that you and a lot of plastic surgeons warn away from doing any sort of implants or stuff with the posterior because it's just impractical, and the way that we move and sit and live,
Yep.
it's really risky. But have you had people, I'm curious, post-Kardashian days especially, start to ask more questions about what can be done?
No, absolutely. We're getting many more inquiries in terms of, butt augmentation. I think bigger booties are becoming more fashionable. I think smaller chins are becoming more fashionable with the selfies. And I think you're exactly right.
Yeah.
The plastic
Yes,
surgery.
I am.
Yeah, well, absolutely. Plastic surgery, I think, oftentimes mimics what's going on in social media, which reflects society and who we are.
And what do you tell someone who's interested in having a bigger booty?
Well, I think that it's,
Go to Brazil?
go to Brazil.
Do
or-
some squats.
Do some
Yeah, do some-
squats.
Do a
Well,
lot
lunges,
of squats.
Yeah,
lunges.
I think
Have
one
some
can
hamburgers.
clearly get a bigger, gluteus maximus and medius. Clearly, I think that's the easiest way, but it doesn't make a huge difference. Let's face it. And I think that there are buttock implants and there are fat injections that can be done, but it's just a higher complication rate on these
Yeah.
procedures. As plastic surgeons, we like to do the operation that gets the biggest bang with the smallest complication rate for our patients. And butt implants are they're just a higher complication rate. Not that you can't get a good result, not that there aren't people that do a lot of them, but you just got to be careful.
There's a lot of people, this is the last question I'll ask you, but there's a lot of people who, and I see this a lot on social media and among friends on Facebook, they will lose a tremendous amount of weight through diet and exercise.
Yep.
But then they find that even though they're much thinner, they have a lot of issues with their body being tight because they have so much skin that encapsulated all of their extra weight. And what happens then? Even, and I'm not talking just on the stomach, because you would think, of course, tummy tuck, but like on arms and legs and all sorts of parts of the body.
It's a big problem because a lot of the massive weight loss patients, they get the weight off and they're doing great, but they look worse sometimes because it's kind of like losing a lot of fat in your face, losing the curves and whatnot. So what we have to do in answer to your question is go in and remove that redundant skin, and that might be, that might involve taking it off the arms,
underneath the arm where the bat wing thing happens. Which we call brachioplasty. We talked about the tummy, but also in between the thighs is an area that oftentimes it just hangs, and there are some people that do total body lifts and actually go into the back region, and so. I think you're exactly right. It's a skin excess procedure, and the only way to deal with that is to remove the extra skin.
So don't lose weight.
Yeah, don't lose weight.
Is that your
This
takeaway?
whole conversation.
If you have questions about your own body or certain procedures or what would work best for you in your particular situation, if you've thought about that and you want more information and you really want to talk to somebody about it, a great place to start is Dr. Workman's website, drmichaelworkman.com. A lot of times you can have questions submitted right there. You can see and read about different procedures. You can see before and after pictures. And it's a great vehicle for just getting started in what can be a kind of an overwhelming or embarrassing or unusual process for you. And then if you're very lucky, you can meet Dr. Workman himself, and he's a delight, and we love you.
Sure is. He's the
behave.
best.
drmichaelworkman.com, the website. Dr. Michael Workman is the doctor, and we'll see you in a couple weeks.
All right, look forward to it.
Thanks, Doc.
The Buzz.